No one wants to spend more time at the doctor's office or hospital than they need to.
Now, plenty of patients are cutting their wait times in half because of a new facility at Munson Healthcare Grayling Hospital. Michelle Dunaway and Corey Atkins take us there in the MedWatch report.
We're unique. We're the first one in northern Michigan.
Which of the rooms are used?
This is the Patient Diagnostic Center at Munson Healthcare Grayling Hospital.
It's all about length of stay. We're striving to decrease the length of stay of our patients that are in the hospital.
This type of facility is really considered the future of medicine.
The idea of it is to be truly patient-centered, where all of the testing and all of the care is brought directly to the patient, rather than the older model that we have where we have to take the patient to several places to see several different departments, several different staff members. Everything comes to them in the new unit.
It's only a month old and is serving patients who need observation, behavioral health patients waiting for placement, and plenty of surgical and diagnostic testing.
Before we had this diagnostic test, patients that were here for diagnostic testing, such as a cardiac stress test, would have to be admitted to a general medical ward. And usually they were the least sickest patients in the hospital, though. So as providers, we see the sickest patients in the morning and the least sickest in the afternoon. So these patients would usually not be seen until the end of the day, though. So that may cause a delay in diagnostic testing, such as labs or stress tests, and potentially that could increase the length of stay. Hello, I'm Dr. Davis.
Nice to meet you, Dr.
I'm going to be your physician today here in the pre-op clinic.
John Davis is the hospitalist here. He says the facility certainly makes his job easier and makes him more effective.
It's been really rewarding now to know that, once I get done seeing one patient, the other one is, right down the hall, though, and I don't have to walk to a different floor, a different wing, though. So yeah, it's definitely putting the provider with the patient longer. So, and I think that's increasing the quality of care.
The environment is better suited for the people who fill these beds.
We did a lot of work on the design of the equipment and the unit in order to make it so it's very comfortable for the patient, taking into account their safety, their comfort, and their entertainment, so that while they are here for 6 to 8 hours, it's something that's really conducive into a place that they want to be and enjoy being.
And while that may seem like a long time, Dr. Davis says on average, patients here for diagnostic testing are cutting their stay by 5 to 7 hours. A win-win for all involved.
We're focused on pursuing the next direction of healthcare, though. What's the next direction? It's all about concentrating on decreasing the length of stay, improving patient satisfaction, and also being more cost-effective. And I think this center hits all three of those points.
For MedWatch, I'm Michelle Dunaway.